My name's Tom Quick. I'm a brachial plexus surgeon and a clinical academic. Brachial plexus injuries involve the function of the arm. Any injury to the brachial plexus leaves people with muscles that don't work, sensation that's altered or changed or lost, and significant nerve pain. Treating all of these aspects can improve patients' quality of life and outcomes. It's a real joy to be able to bring benefit to patients. The camera is incredible. It's really helped safety and teamwork because it gives the whole team a view in an area that normally they wouldn't be able to see. It's a small wound where we can magnify up the image, see the wonderful nervous structures. It's a really great tool for nerve surgery all over the body. What I love about ORBEYE is it's just a plug in and play system. You arrive in theatre, plug in the TV, and it's up and running. It's really, really easy. As a surgeon, the use of the camera in operating means that there's a huge relaxation in the surgical posture. Cases that can go on for longer periods of time are much easier to maintain concentration and skills in terms of stabilization of hands and dissection. The specs of the 4K 3D visualization really are amazing. It's almost better than real life. The joy of the camera and the way it's set up is you can get a view in all sorts of angles that you wouldn't be able to with the normal use of loops or even with a surgical microscope. There's a huge field of view when magnified out, and the manipulation of the camera allows you to almost see around corners and get views that you wouldn't be able to see with the normal human eye. You lose none of that clarity, none of the depth. It's really incredible. It's a wonderful piece of kit. The team have found interacting with ORBEYE really easy. It's a single person draping. It frees up the rest of the team to be getting on with prep. It's simple and straightforward. We've looked at the interaction around theatre with feedback from all the theatre staff, and it's been incredible actually how engaged people have been with the operations purely due to the fact that they've seen and interacted with it. I think it's been a huge improvement to our safety and inter-theatre communication. The rep support that we've had has been incredible. The online training videos have been a great resource, reassuring them about the ease of single user draping and communicating and being linked up with colleagues who are using it regularly within their clinical practice, for example, at the National Hospital for Neurology and Neurosurgery at Queen Square. It's great to be able to communicate and take tips from each institution backwards and forwards. As surgeons, we're privileged to be able to see inside the human body, but to be able to share that with the patient, for them to understand what the problem was that's led to their pain, to their dysfunction, is incredibly powerful. Patients in clinic are able to put on the 3D glasses and see edited highlights of exactly what the problems were and how things are then treated and improved. For the patient to be able to take that back home to their family, to their relatives, to show them exactly what was the problem and understand how that's been improved is hugely powerful. But I think also interaction with their treating team, their therapists, their doctors, it spreads appreciation of exactly what the surgery has meant and improved, and I think helps them with a great understanding and engagement with their own medical condition. The ability to provide a 3D visualization that you can take away, edit, play for teaching, medical, paramedical training, it's incredible. There's a novelty still about 3D visualization, and it gets people really excited to be able to show that, the added interest, but also the interaction of being able to see all those anatomic structures. Specifically with the brachial plexus, 3D orientation is so important. They learn it on a flat page, but to have that as a 3D resource is incredible. The use of large and small screens within theatre brings the whole team in, but I think there's going to be huge changes in the visualization of 3D technology. Goggle use, for example, I'm sure is something that's likely to change within the future. And again, taking the input from the 3D cameras and using that with 3D mapping, modeling, maybe even 3D printing, I think is going to be incredibly exciting. For anybody undertaking brachial plexus surgery, this tool provides a huge improvement. An improvement for the surgical experience, an improvement to the interaction of the surgical team, but I think wider than that, patient education, paramedical and physiotherapy training, and understanding of problems and surgical outcomes, I think are huge. So I think it's going to improve practice, both in theatre and in clinical practice, and also patient experience.